watch, tie, jacket, drinks, more drinks. Tonight we're sending off the year in true 2020 style, all while dressed up and nowhere to go, except a Zoom call. We're talking to fellow newsies who reported on the stories that defined this year. And then let's all agree to never speak of 2020 ever again. Here's to the new year. No. Gonna need something a little stronger than that. Folks, we know that everything that glitters isn't gold. Luckily, our next guest doesn't have this problem. He is always shiny, always luminous. Here to talk about one of his favorite pieces of the year, Cody Legrow. What's up?
Season's greetings.
I love your holiday outfit, right?
Yes, I only packed one just for you, Christian.
2020 has been one hell of a year, and that's an understatement. Tell me a little bit about your resolutions for 2021. Do you have resolutions?
Sweetie, I don't know how we improve. I'm back and better than ever. But
if only everybody else could take that amount of confidence into 2021. Cody, I wanted to talk to you about one of your favorite pieces of the year. Can you tell us a little bit about the piece and why you felt it was significant to do this bit of reporting?
The piece I decided to discuss with you today that kind of reflects on everything we've all endured this past year is a piece I did that kind of highlighted the parallels between HIV and COVID-19 and their impact on Black people. We continue to hear from members of the Black community that the social justice system is dismissive of the Black community. And then when you start looking at HIV numbers, they have a greater impact on Black people. The one source I had that I could really tie all of this in together and how they're related was Dr. Anthony Fauci. He was an integral part of how we treat HIV in this country. He did a lot of work in the 80s and the 90s to fix the system. And he's also an integral part of how we're fixing the system to beat the pandemic we're in now with COVID-19.
Any sort of takeaways or immediate sort of responses to the work that you actually put out?
Science is science, and I think we all saw the truth under attack this year. Will the gays ever be able to brunch again?
Yes.
Would you actually brunch with Fauci?
I am going to manifest that brunch. Me and Dr. Fauci, we're going to brunch in 2021. I'm speaking it out into existence. It's in the universe now. It's going to happen. Cody
has already overstayed his welcome. Cody, thank you so much for joining us, and Happy New Year to you, man. Thank you so much.
Happy New Year, baby.
With LGBTQ plus rights at the forefront, in the middle of social unrest, and a global pandemic, one very important doctor decided to make a house call.
Hello.
Hello, Dr. Fauci. How are you today?
I'm well, thank you. How are you?
And we got right into it.
I read something that you said, HIV is really simple compared to what's going on with COVID-19. What do you mean by that? Can we touch on the stigma real quick? Will the gays ever be able to brunch again?
Yes. Yes, and I'd be happy to join you.
Okay.
You could call Dr. Fauci an ally. In the 80s, he fought for wider access to HIV treatments that saved countless lives. In the 2000s, he was part of PEPFAR, a program to reduce transmission of HIV/AIDS in poorer countries. And that epidemic has something in common with COVID-19 today, a deeper impact on poorer communities of color. Look at the HIV/AIDS epidemic, a thing that is still very much happening in the United States. In 2018, Black people accounted for 13% of the population and 42% of new HIV diagnoses in the U.S. COVID-19 is no different. In places like Chicago, Black people are 30% of the population, but 60% of its COVID deaths. Pandemics expose yet another way we fail people of color.
Because of the social determinants of health and the positions they find themselves in economically and regarding employment, they in fact have a higher risk of getting infected. And when they do get infected, they have a disproportionate amount of the comorbidities that lead to a serious and often fatal outcome. Heart disease, hypertension, diabetes, obesity. So the disparities are very, very similar.
Our healthcare system parallels our social justice system. It's dismissive of Black people.
Deja Abdul-Haq is the director of My Brother's Keeper and Open Arms Healthcare Center in Jackson, Mississippi, a clinic that caters to Mississippi's LGBTQ+ community in a state with the highest concentration of Black people. Mississippi is in the middle of HIV and COVID-19 epidemics. Treating HIV and COVID-19 share similar complications for people of color, including access to testing, treatment, and education. Still, the clinic never shut its doors to the people it serves, typically low-income and or queer people of color. Mississippi is still seeing a rise in COVID-19 cases. Hospitals are concerned about capacity, and yet it's reopened and back to business.
There are a lot of people who believe that the reason that our federal and legislative leaders wanted to reopen is because they noticed, oh, this is impacting Black people. So it's okay for, Black folks to suffer.
So why do the perceptions of infectious diseases linger for some and not others? Stigmas surrounding HIV still exist, but with COVID-19, they pack less of a punch.
Whenever you have a disease that's new, that tends to selectively or predominantly affect a certain demographic group, that group often gets blamed as the source of the particular illness in question, the particular infection.
I talk about the Chinese virus.
Back in the early years of HIV, it was not good at all. Racial and ethnic groups get stigmatized because of that. The reason I don't think you're seeing that so much with COVID-19 is that this is an infection that spares no one. Right now, we have a situation where we're trying to end HIV in the United States. And in fact, this administration has put together a program to end it in 10 years. Hopefully, we'll be able to do it.
So as places like New York City bury unclaimed bodies from COVID-19 in mass graves at higher rates on Hart Island, a familiar site for unclaimed HIV/AIDS victims, Abdul-Haq says we can start saving our brothers and sisters through societal change.
Stop making it okay to mistreat Black people. Stop making it okay to dismiss gay people. Stop making it all right to not consider the needs of poor people. Stop doing that, because eventually the evil that has to be fed is going to come for the next joker.
After the break, we'll pull back the curtain on how one of our own reported on the biggest story of the year. Also, let me freshen this up a little bit. Arguably, the biggest story of the year is the coronavirus pandemic. And a lot of the reporting has focused on the number of cases, the deaths, but there are also stories of resilience, of kindness, of triumph. Somebody who has covered the breadth and width of the pandemic is our very own Lindsay Yates, and she's here with us for our New Year's Eve extravaganza. Lindsay, what is up? How you doing?
I'm doing good. So glad to be ringing in 2021 with my sparkling water and my pajamas.
With sparkling water and pajamas, you must have a crazy New Year's Eve planned. I mean, what do you have going on?
If I can make it to like 12:02, I am good. I'm one of the people that is usually passed out before the midnight bell rings. So,
which is fine. To each their own. I totally get it. I think many of us are going to be doing the same this year. One of the things that you and I have talked about is really how this year has shifted our responsibilities as journalists. Tell me a little bit about some of the reporting that you've done this year and maybe some of what you tried to focus on.
I think anytime I'm reporting on a medical or science story, I kind of put my lifelong learner hat on. I think with this pandemic, there is still so much that we're learning every single day. So my approach has always been, what kinds of questions can I help answer as someone who's just curious, but also, you know, that my friends or my family or our viewers might have.
One of the stories that you did really kind of focuses on the vaccine rollout and healthcare workers. Can you kind of set that up for us a little bit?
We had an opportunity to go into one of the hospitals in Denver, where I'm based out of, and pull back the curtain a little bit on what the process was looking like, from them filling up these vaccines with doses of the Pfizer-BioNTech COVID vaccine right in front of us, to, you know, shots going in the arms. One of the biggest things as a news person that this year has taught me is how to take some of those really complicated concepts and terms and put them in a story in a way that, one, we can all understand, but also, two, I think, trust and connect with some of these health experts and doctors and scientists that have spent their entire lives and careers, you know, working on this stuff.
So you guys ready?
As hospitals across the country roll out their vaccinations of frontline healthcare staff, it's a glimpse of what's to come for all of us in the months ahead.
COVID-19 is a horrible thing. It's taken a lot of lives that we have witnessed, and I think it's important that people understand that getting vaccinations will help you.
At Presbyterian St. Luke's Medical Center in Denver, a team of 30 decided who would be the first among their staff to get the vaccine. The hospital expects to go through 975 doses in 4 days. This is not just, you know, doctors and RNs in the ICU.
Absolutely, it takes a whole group. We have people that, you know, help clean our rooms. We have people that deliver food. Everybody that comes in contact, respiratory therapists, pharmacy folks.
ER Intake Secretary Joyce Jones was the first to roll up her sleeve after she was deemed most at risk.
I'm the first person they see when they come in. That's why.
Her reason for saying yes to the shot? Her family.
They mean the world to me. You know, it's my husband who's been with me for over 40 years, and my kids, and my grandson, and my granddaughter. You know, I don't want them to get sick. I don't want them to go through things I've seen.
Altogether, today, Presbyterian St. Luke's plans to vaccinate about 300 members of their medical staff, and the vibe has been nothing but joy. I've even seen a few feel-good tears.
Are you getting yours today?
The vaccine process is proof of lots of planning. Every 15 minutes, 5 people arrive to get their shot. Each person goes through a brief check-in where they get asked about allergies and fill out their follow-up card. At the same time, an infectious disease pharmacist preps the doses in the shots.
We're kind of working in tandem here. This gentleman to my right, he is diluting the vaccine once it has thawed, and once the vaccine is diluted, and then I am drawing up the doses here to be administered.
After the shot goes in,
So we're going to watch you for about 15 minutes.
the vaccinated staff wait for 15 minutes in freshly sanitized chairs. It's in case there's a sudden bad allergic reaction, which has been known to happen, albeit very rarely. They'll wait another 24 to 48 hours before returning to work.
Oh yeah, I feel good.
It's a well-oiled machine, one that will be churning for several hours each day in the coming months. Lindsay Yates, Newsy, Denver.
The way I see it, 2021 resolutions should be a breeze. I mean, it's not hard to improve on perpetual dumpster fire. So we've talked a bit about the pandemic and how devastating it's been for a lot of us, but it has also intersected with a lot of other intricacies, a lot of other nuances in our lives, and a lot of other topics that people have been reporting on, including criminal justice. And to talk a little bit about the year that was in criminal justice and criminal justice reporting, I decided to bring on my good friend, my brother, dad of the year, Jamel Andrus. Jamel, thank you for joining us for the New Year's Eve episode of In the Loop. I didn't think we'd make it here.
Yes. You look great, man.
Thank you.
Awesome.
The suit fits, and I think that's the thing I'm most surprised about.
I haven't had a suit on or anything of note really since March.
Right.
So this is a big deal. I'm excited. I'm excited to be here.
Before we get into some of the reporting you've done, Do you have any resolutions that you're really gonna dive into for 2021?
I have a child, as you know. Not sure if the audience knows. So keeping that baby healthy is right up there.
Can you tell me a bit about some of the reporting that you've done this year as it pertains to criminal justice?
This year has largely been about two things. Firstly, police brutality and its aftermath, and then, the coronavirus behind bars. Watching all 50 states, from New York to Montana to Louisiana, Arizona, every single state come out and protest after the death of George Floyd was remarkable. Coupled with that is what we saw in regards to coronavirus ravaging prisons across the country.
I wanted to talk a little bit about the story you did back in April.
I'm here in Chicago, and to their credit, the Cook County Sheriff's Office here in Chicago started doing testing on COVID fairly early. But regardless of that, they still lost lives, and one of them was a gentleman named Nicholas Lee. I spoke to his wife, Cassandra Greer Lee, about this situation. One of the things she really wanted to get across is that she was not advocating for her husband to be released from jail. What she wanted was her husband to be protected. This is an ongoing problem. As the coronavirus peaks across the country amongst civilians, so does it behind bars. And so, it's an extremely important issue that is ongoing into 2021.
I'm more introverted. My husband is more extroverted. So I am like a house type of wife. We watch movies. Oh my God. But what we really enjoyed doing was going to the lakefront and just sitting, just watching the sun come up. He was just my best friend. My husband was only 42. We had a lifetime still left to live together and to be happy with one another. He had a chance to come back out into society and be a productive citizen. Cook County found him guilty. They not only found him guilty, they gave him a death sentence. I want somebody to be held accountable for his death. Money can't bring my husband back. Nothing can bring my husband back. An apology, it would be nice to hear, but it can't bring him back. I don't want this to happen to another family, because I know to the world they could be detainees or inmates, but guess what? That's somebody's son, it's somebody's husband, it's somebody's daughter, it's somebody's brother, sister, cousin, nephew. It's someone's loved one. If my husband did something wrong and a judge found that he was guilty, he would have had to do whatever time the judge set. But did it warrant him to die? It didn't warrant him to die. All I'm saying is that, no, was I one of the people that was saying, release my husband because it's a pandemic? I wasn't saying release him. I was saying protect him. He was having difficulty breathing, so he would say a few words, and he was on a CPAP machine, so he put it back on, and I just told him, just lay back and relax, just listen to me. I prayed with him, I encouraged him, I told him to keep fighting for me because I need him, and I still do, but God saw fit for something different.
If you haven't done so already, it's not too late to connect with us on Twitter using the hashtag #NewsyInTheLoop. My blood type right now is sparkling wine, so you don't have to worry about how I'll take your stinging criticism. So this year, one of the things that a lot of us have missed out on, especially music lovers like myself, is going to live shows. That along with a lot of other activities were restricted this year. Somebody who has reported on independent music venues as well as entertainment and pop culture is Casey Mendoza, and I'm so happy to have her here tonight. Casey, thank you so much for joining me.
Of course.
Before we dive into some of the reporting that you've done, do you have any resolutions, anything that you're really going to try to work on in 2021?
So because of the fact that I haven't been able to go to movie theaters or go to an indie venue to see a concert, one of my biggest New Year's resolution is to just find more ways to support the artists that I love and the venues that I love by throwing money at them. I see a lot of my business.
One of the things that you've covered a good bit throughout this year is how independent music venues have kind of suffered under the weight of the pandemic. Could you tell us a little bit about your reporting and also give us just the scope of how badly it's been for music venues this year?
Music venues, as of now, they've been closed for almost the entirety of 2020. And one of the things I really heard while I was reaching out to indie music venues or concert bookers was the fact that these businesses were the first to close and the last to open, just because of how many people it takes to support an indie venue for like one night of a concert.
Are there any takeaways from your reporting that really kind of stuck with you throughout the year?
One of the things that I really had to learn while I was doing this reporting was how important these indie venues are, not only to the music industry, as you would immediately expect for a music-focused business, but also for local businesses around the country or local communities around the country. You know, live indie venues are typically surrounded by local restaurants or other gift shops or hotels. They're very supported by these events.
Are there any bands, any shows that you're really looking forward to seeing in 2021?
This isn't music, but I was gonna go to a rowdy screening of Cats at the Chicago Independent Music Box Theater. So excited. Didn't happen. So I hope in 2020 I can go back and maybe support these venues again.
I hope your rowdy viewing of Cats is much rowdier than our imaginations will allow us to think. So cheers to you, Casey. Thanks for joining me.
What are some of your favorite music venues across the country?
Joe's Live, House of Blues.
930 Club in Washington, D.C. is one of my all-time favorites.
I'm standing on my favorite venue, which is at Fitzgerald's nightclub.
Independent music venues are some of the hardest hit businesses during the pandemic. As the first to close and last to open, many in the music industry are worried about whether their stages can survive the lengthy closures, continuing expenses, and massive revenue losses.
There's a lot of just like legendary venues that are really in danger right now. You know, like places that like Nirvana played and the Ramones played.
The biggest question I get is, what are you going to do? And I've tried to answer that question for months with some type of creative response, but the reality is that there's not much we can do besides sit and wait.
We did a survey of NEVA members a couple of months ago and found that if the shutdown lasts 6 months or longer and there's no significant federal help, 90% of NEVA members said that they will go out of business entirely.
NEVA is the National Independent Venue Association, and it's lobbying lawmakers with the Save Our Stages movement to establish grant programs and tax credits for struggling venues unable to survive on existing small business support programs. As a national organization, NEVA is unprecedented itself.
This association didn't even exist until the pandemic. And now we have 2,000 members, venues across the country in all 50 states and Washington, D.C.
The movement is finding support from both sides of the aisle, and that's because the issue affects local economies as much as it does the music industry. Last year, a survey from the Chicago Loop Alliance found that each dollar spent on a ticket generated another $12 for local businesses. Outside of the US, the UK government has already approved almost $3 million to support English music venues and nightclubs, meaning individual businesses can receive between $1,200 and $100,000 in emergency relief until September. In the US, it's still unclear if federal financial support will be approved in time, and as the pandemic continues, that pressure rides on top of the uncertainty of when venues can reopen at all.
I think every musician at this point has sort of had the thoughts of like, will I ever play a show again?
There is no end in sight currently. So these call to actions are very important for our patrons and our venues and our artists.
Casey Mendoza, Newsy, Chicago.
That's it for us, gang. As always, thanks for watching and supporting us throughout the year. We'll be back next year for more In the Loop. Same time, same place. You don't have to turn your TV off, but we're going to get the hell out of here. So